Good day, friends of Buzzy. I am, as you may know, in my office, so I am not wearing a mask. But today I am wearing a dude robe. So I know this may look to you like I have completely gone native and I have decided to embrace my inner sweatpant wearing self, but we're gonna do something new. So as you may know, I am also Dr. Amy Baxter and do emergency medicine in one of my lives and research in my current life, but I'm also an entrepreneur. And so I have had the enormous pleasure and delight of being able to work with the Shark Tanks, the Shark Tank pals. So I got to go on Shark Tank, and anybody else whose episode airs gets to be part of a Facebook group. So I have made friends with just some amazing people who have helped me learn things that are way outside my comfort zone. So speaking of comfort zone, today we're going to have the comfy inventor and entrepreneur Howie Busch, who made the dude robe. So I have bought these for all of my family because I love them, but that's why I'm wearing that. We are going to talk about coronavirus first because that's how we roll. And I'm going to talk a little bit about some stuff that's coming up with our products that's fun. So first of all, as you know, I am a huge proponent of nasal irrigation for clearing out the entry point for coronavirus. So it turns out one of the things I was going to tell you was, all right, so there's been a lot on the news this week about, does coronavirus enter through the eyes? Does coronavirus enter through the throat? So I've talked to a number of people, and certainly there are patients who have tracheostomies, so they're not breathing through their nose, they're breathing through here, and they've gotten coronavirus. Clearly, they also have underlying other conditions, or they wouldn't have a trach. There's one case report of a doctor who very strongly believed that the only place he could have possibly gotten coronavirus from was through his eyes, in one place where he thought he was exposed. Now, there are ACE2 receptors that are in the eyes, and you could have coronavirus that goes in the eyes and goes to the tear ducts and go down. The thing about that seems sketchy to me is that the viral load, in order to actually get sick from coronavirus, you have to have a fairly significant number of actual viral particles. So the viral particles are large, they're about 120 micrometers. They are not as easily absorbed by whites and Latinos as they are by African Americans, interestingly, just different particle uptake. And as we've talked about before, the thing is that as you age, your nasal cavity gets bigger, you also get more and more ACE2 receptors. And I remain convinced that between 85 and 90%, and possibly even 95% of people who get infected with coronavirus do it through the nose first. We also know that you're more likely to lose your sense of smell than you are to get a sore throat. We know that when the coronavirus enters, it's actually irritating. There are people who've gotten coronavirus who get a conjunctivitis, so their eyes do get red. Whether that's the initial place or not, we know the coronavirus, once it attaches into the ACE2 receptor, once it fuses, once it has viral particles that start moving through, it is uncomfortable. It gives people headaches, and of course they lose their sense of smell. So this is my contention. I think a mask is very good for protecting other people. I think a mask does decrease you getting it yourself, no question. But if you are going out, or if someone you love is, this is the solution. This is a swimming nose ring. I tried a couple of these, and you do sound weird, and you're gonna taste, and you're gonna, if you're trying to eat things, that's not gonna work so well either. But I was interviewed this week by a magazine asking about air travel. You know, how do you eat on air travel? And are you at risk? Should you just wear the mask the whole time? So one thing that this does is, if you are thirsty, if you're going to dehydrate on the plane, or if you're in a place that you want to eat or drink and the taste doesn't matter so much, at least this way you can eat without a mask and you're still protecting yourself. So as you can hear from my lovely tone of voice, you do sound a little funny. And it took me a while, so I got a bunch of different ones of these. So these are the swimming ones, and you can buy on Amazon, you could buy them for about $10 for 10 of them. These are little plastic guys. They're about 7 for 10. I don't like these little colored plastic guys. They actually hurt. And so, or at least for me, so the metal ones, the nice thing about the metal swimming rings is that they are not that uncomfortable. And you can also change the size. But these I feel like are made for children, and if I pushed them out too hard, in addition to looking like Cookie Monster on my nose, if I pushed it out too hard, I think it would crack. So what I'm doing is if I have to go any place inside, because we know that coronavirus doesn't circulate in places with stale air, with no open airflow, no windows. So if I have to go to the grocery, if I have to go through a checkout line, if I have to stand in line for anything, then I'm going to have that on under my mask. So I'm still going to wear a mask. For a while I was thinking about not, because I thought, I really want to emphasize to people that this is where you're catching it. So if you're not breathing in through your nose, you're not catching it. But I still think there could be 5 to 10% that get it through the mouth. And I also think that it is possible that this will help you not spread it to other people when you're silently shedding, because we know there's a lot of silent spread. We also know that the mouth is where the respiratory droplets are coming out of. So you can spread it through the mouth, but the intake into your body, that's really primarily nose. So I recommend getting yourself some of these cheap little guys. I make no money on them. They're not my product, but I will say that here's segue. So my product is, VibraCool got mentioned in a practical pain management article yesterday about physical therapists and home PT, and how doing VibraCool was the cheapest way to get good pain control at home. So we'll post the practical pain management article, but that was a thing that we didn't expect, that a gift that keeps on giving. And now that we're talking about gifts that keep on giving, I see my friend smiling because this is Howie Busch. And we often refer to Shark Tank as the gift that keeps on giving. So welcome, Howie. Thank you so much for joining me. I'm getting your picture here, but you look great.
Hey, thanks for being here. As always, great to see you.
So we have been ordering extra inventory because I very strongly believe that both China and the US are going to get another dose of coronavirus that's going to shut things down sometime in the fall. What are you doing with your supply chain? How has COVID affected you? And tell me how your business is going now that people are staying home and needing robes more.
Yeah, I'll tell you, it has been absolutely crazy. So I can't even believe how many orders are coming in. Like, obviously people want to be comfortable while they're at home, during quarantine, but also just in general. And what we have, and you have one, you bought it for your whole family. It's just a cooler option, right? Like, we redesigned it, made it a little bit cooler, made it more like a hoodie, more for today's guy. And people are really, really responding. I mean, sales have been crazy, but with that definitely comes, and with coronavirus around the world, definitely comes some supply chain issues. And for me, when it started in China, I don't manufacture in China. I manufacture in Pakistan, and I was like, oh, this sucks, but thank God I don't manufacture in China. Oh, sure enough, my factory ends up getting shut down for a month. Pakistan got hit, they shut down for a month, and then they were, at like half capacity for a few weeks. So it's been a little bit slow, and I put in my biggest orders to date, and I'm waiting for, they're starting to come in. So there's been great to it, but there's been tough to it because people are having to wait for their orders for whether it's a week or 2 weeks or whatever it is. But people have been incredibly understanding. I'm kind of sharing my journey with them as I'm going through it and showing them literally I'm fulfilling out of my garage instead of fulfillment center because I was worried they were going to get shut down.
Well, yeah, we had that same thing happen, that we had, and it only ended up being a couple weeks back order, but someone on the floor of our fulfillment center got coronavirus, and so then everybody was trying to deal with all of the orders at the same time. So how many of your people work remotely, and how has that been for your business?
So I'm kind of all remote anyway, right? It's me, right? And then I have mostly like freelancers around the country and world. So that part of it hasn't affected me from a work perspective. It hasn't affected me that much, literally like an interaction perspective. But the supply chain, the fulfillment, but you know, being a Shark Tank person, I know you have the same type of attitude. You want to make lemonade out of lemons, right? You want to make a good situation out of something. And what I decided to do with that is really engaged with my customers. So I'm getting questions on, you know, what's going on. Even if I send out, you know, you send out like what's going on, but not everybody sees it, whether it goes to spam or they just didn't read it or whatever. But I've had a lot of back and forth with my customers, and I think that's been really great for me and my product. And remember, my product, you know, it's not a $10 or $20 product, and I think people really appreciate it. They feel like they're getting that customer experience, you know, of being part of the brand, which is really what we're building.
Yeah. You know, I mean, you didn't need to pivot because you've got, so here's the DudeRobe. Let's see if you can see it in my office here. So it's got a possibly longer than it needs to be for me wrap. So it's got that, and then hood, and then the cool thing is it's got two. So it's got a pocket on the outside, and then it's also got pocket on the inside. So I think it does. So it's got
you can see it.
Yeah.
But you know,
there it is.
What I think that's what I'm hearing from people, what they really love. So some people love that the sleeves are like hoodie sleeves and they don't flop all over the place.
Yes,
right?
now that I'm wearing I'm going to switch it back to you. Right now it's on me.
Yeah.
But that is one of the things that's a big deal is that I find that when I'm, you know, if I have to clean up dishes or I come down the night before, even if I'm just messing around in the sink, that my other robes fall in and they track stuff all over. And so you're right. This is a big deal, and then the towel stuff on the inside is a really big deal. But so you didn't have to pivot because your product is already custom made for people who are staying home and being comfortable. But our big pivot was, you know, here's our VibraCool that we're sending out, but all of these people who can't get to the doctor's office and who can't go to their massages and can't do anything else. So we have been including a pain care package. So we've really got a lot of new partners. We've got new stay-at-home pain management. We've got creams. And so we're giving free samples like crazy with all of our VibraCools. Have you done anything for anything that's related to coronavirus besides just reaching out to your customers? Or has there been anything else that's changed the way you do business that you think you're going to keep going forward? Because we're going to keep our pain care packages because it's really gotten such good response. Anything that's going to stay with you from this?
Well, first of all, I would say that's awesome that you did that. I think that's so smart. I love it. You know, it's a value add, and people appreciate that. So one of the other things I've been doing since I'm fulfilling from home, I have I happen to have one here, like a card. I don't know if you can see it. It's a card that shows the DudeRobe. It talks about the evolution of lounging. And I write a handwritten note in every package that goes out right now. And I'm trying to figure out a way how to continue that without, you know, with being able to continue the scale that we have going on. I don't know if I'll be able to, but I would like to be able to. And in terms of other like practices, what I'm doing is, and I do this every year, but I'm really looking now, if there's any way to be able to manufacture here, I'm going to try it. And I'm starting to add in some other products also. So I did a collaboration with another Shark Tank pal, eye slides. So we added like flip-flop slides. And it's, we're literally about to put them onto the website.
Oh, which design did you pick? Because I know you sent something around to the Shark Tank pals, and I picked which ones I like best. But is it a secret? I like the ones that were white that had DUDE. So when you put your feet together,
they all had DE. They all had that.
I like the one that was in the upper left-hand corner.
I think that's one. It was blue and white, right?
Yeah.
White?
Yep.
So that was the one that had an overwhelming favorite. But so we're adding that. It's cool that we're doing a collaboration with another Shark Tank company who I love. He's a great guy, and people should check out iSlide USA. And then we're looking. I didn't want to jump into the mask bandwagon, but we might, because I think we may have been able to source something here that's got like a cool fabric that has like some value add that makes it just not like every other mask that's out there.
Yeah. Well, I was talking to somebody today who's actually connected to a whole bunch of soft goods sewers in Utah. Apparently, like 30% of the population in Utah are seamstresses and can mostly female. But I'll hook you up with them because he's moving some production over, and that may be a really good place to look for U.S. manufacturing.
Yeah, perfect.
So I know that you have a Father's Day deal going. Would you be willing to share that with our Buzzy Helps folks as well?
Sure. So we're doing a Father's Day deal, and like I said, it's been really crazy. But I do believe so. The code we're using is Robe 20.
Robe 20. Okay.
And that'll give you 20% off. And I literally just got like 2 minutes ago while we were on the card we're doing. Just in case we need it, like a Happy Father's Day thing. If anybody wants to use it, it's a cool looking digital download. But we should be totally caught up. My manufacturer told me this morning that we'll be fine. We should have all of our goods in the country. We have some, but we're running out fast. But we should have it all here in the next like week or 2 weeks.
Oh, awesome. Well, I've got 2 boys and a girl, and my husband, and all of us, male or female, really, really enjoy our dude robes. So we love having that. So one question I have been dying to ask. My uncle loves the Dude, Jeff Bridges. Just loves the movie, loves everything about it. Does Jeff Bridges have a dude robe?
He does. He actually does.
Do you have any pictures?
So what you don't know is in my previous life, I was a sports agent and an entertainment agent. And one of my old clients reached out to me, and I know he happens to be friends with Jeff Bridges. And he said, hey, can you make one that says the Dude on it?
No way.
Which I did. And then he said, can you make one that says DUDIE, which is Dude, which is what his grandkids call him. And so he promised me he would get me a picture of the Dude in the Dude robe that says the Dude. Don't have it
wow.
Yet. Don't have it yet. But I'm going to get out there with you when I get it.
Oh my gosh, I can't believe in all this long time of knowing you, I did not know that story. That is magnificent. Well, I'm so glad. Is there anything else that I should have asked you or anything else you'd like to end with before I cut us off? No,
but I want to catch up with you. And listen, I learned a lot from the beginning part of this with the whole nasal thing. I mean, I knew that was part of it. I didn't realize it was as big as you're saying. And frankly, my daughter, like, a week and a half ago, 2 weeks ago, flew out to LA and wore the mask the whole time while she flew. But it's good. It's good to get that kind of knowledge that you have because of where you're situated of how to deal with something like this because it's crazy out there, especially being in New York.
Oh yeah, well, I think that's what really why I was so excited about the swimming clip thing is because it is such a simple maneuver, and I'm connected now with 12 different groups that are all doing variants on nasal spray, nasal irrigation, hydrogen peroxide, betadine, using the Neomed thing, using just sprays with betadine, doing it 2 times a week, 2 times a day, 4 times a day. I mean, there's a group in Iceland that's using neem oil. So there's so many different antimicrobials that people are trying because everything about how you're getting it, all these weird things make sense with nose stuff. I mean, it's all, if you're obese or hypertensive, you make more ACE2 receptors. If you are older, you get lots more ACE2 receptors, all of them in the nose, mind you. And so anyway, there's a lot of just the sinus cavity size going along with the age spectrum, the male-female thing, that men have much larger nasal cavities, particularly over the age of 70, than women do. So that was when I was like, you fly someplace or you're sitting in the grocery store and you can be as careful as possible with your hands, but you're just not sure if something has come inside the mask or if somebody coughs and it's circulating. And so just to know that the place where it enters that matters, you can put something on and you're not going to have any air going in your nose, which means you're not going to have any viral particles going in your nose. So that's that. Once I became really convinced that almost all the spread is nasal, that was a very reassuring thing. So that made me feel more comfortable going to the grocery store when I have to and doing all that.
Right.
So,
Can
well,
I give you 2 quick things?
yeah,
Can I
sure.
do
No, go for it. Yeah,
So one, what I didn't even think about is I do hear from people who are like guys who like are in, whether, you know, they are housebound, not just to the quarantine, but because they pain and illness and stuff like that. And they tell me they love the dude robe because they can feel, you know, they don't feel like an old frumpy person and they get to wear something they feel cool with and it's whatever. It's just a better mousetrap for them. That's one thing. The other thing is I'm going to share a quick New York coronavirus story of a friend of ours who, it's a friend of my mother-in-law, who's like an 80-year-old guy, went in early with COVID and had pneumonia and ends up going on a ventilator, which you know the odds when you go on a ventilator, not so good.
92% croak.
With like Crohn's disease and like he's got like major stuff, right? He ends up going into, he was basically in a medically induced coma for like 3 to 4 weeks, and they told his wife, plan his funeral. Like, you know, basically he was in palliative care, and they're like,
Wow.
you know, just go do what you have to do. That was on a Thursday. Go do what you have to do. You know, we're just gonna like ease him basically off, whatever. That Sunday, he wakes up, he says, where's my wife? And I don't know, and again, I don't know the timing of the medically induced coma or not, you know, what he was off of that, obviously. He ends up, he was like not perfect right away, but he wanted to know where his wife was. And then over the course of that week, a week later, he was out of the hospital, he went to rehab, and he's home now. You do not hear stuff like that, right?
Well, you know what you do? You hear it when they have Crohn's and they're on Remicade, because that is actually, I think that's going to be one of the things that I hope those trials get done by the fall when it hits again, because immunomodulators are the things that stop the cascade. So what's killing people with coronavirus, and the reason why you've got such a massive group of asymptomatic people who don't have anything go wrong and then just incredibly sick, is because there are 2 different, it's more than you wanted to know. So there's called T cells, which are one kind of, you know, the first round draft choice to go fight infection is the T cells, and then the T cells spread the word to everybody else through like a telegraph system. And then the cytokines come and they do all the heavy lifting and fighting. And so there are 2 different kinds of medications. There are cytokine inhibitors and there are T cell regulators. And people who have autoimmune disorders, I bet you anything that he's on Remicade. Yeah. They only 5% of them die. It's astounding. They are so much less likely. So that's why. I mean, they've actually got a registry now for people with autoimmune disorders, and what they're finding is if you're on steroids with autoimmune disorders, worse. But if you're on any of those immunomodulators, dramatically better outcomes. So now they're looking at a couple of them prospectively to see if I bet you by October, if you go in the emergency room and you've got ground glass opacities on your X-ray or CT, I bet you're going to get a dose of Remicade or Humira or Canaret or any of those kind of medicines.
Interesting. And by the way, it said I have the antibodies.
Oh, do you really? Congrats. Well, I'll come to you. I was sure I had it, and I tried my antibodies twice because one of the guys who works for me gave me some sets, and either the sets were wrong or I was just wishful thinking. Apparently 20% of people think they have the antibodies and only like 3 do. So
yeah, I'm unsure about that. So active.
Well, congratulations to you. Well, my darling Howie, it was such a good time seeing you. And you can find out from your friend, but I bet you that's exactly what happened, is that his medication stopped the cytokine storm before it was able to capsize his boat. And good to see you, and we'll make sure everybody knows about Robe 20 because it's not just for men, man. It's very great. Thank you very much, Howie. Take care. Bye-bye.